I'm with Dr. Ashish Atreja, and he
We're very excited to have this session, and it's going to talk about everything that we do not learn in the medical school but should be knowing in this age. We'll be covering a lot of topics, especially we have so many tools now.
Yes, I mean, how should physicians be integrating some of these new tools? Let's talk about electronic health records.
Right. So, one may believe with electronic health records, the communication probably has increased with the patients, but you'll be surprised actually. The studies have shown that patients are actually not very satisfied with communication in the era of electronic health records. There's so much plethora of tools now, digital tools with physicians, how to meaningfully engage with patients. And one may think that the communication between patients and providers has really increased in this era because of the tools we have. But you'll be surprised, actually, the studies have shown that the satisfaction level of patients with the communication with physicians actually has dropped.
With what, electronic health records?
With electronic health records especially, because in electronic health record, physicians many times are typing and the computers come in between the patient and the physician. So for example, if the patient is there and I'm typing and the computer is here, I'm mostly focusing on computers because I have to document. And the patients may feel I'm not paying that much attention to them, not having an eye contact, which is the richest form of communication. That nonverbal communication, that gets lost.
Do you have any tips for how to get past that? Or what can a practicing gastroenterologist do to maintain that intimacy?
Absolutely. So it's a very practical session. The goal is each presenter talks about the tools and tricks to how to optimize engagement and communication. So Lin Chang from UCLA is going to talk about how the position of the computer has to be separate so you can actually still have a communication. And the general rule of thumb is anything that has to be documented repeatedly, you create widgets or some documentation templates. So you don't have to write or type everything. You can just use some kind of a smart text and that can populate the note. There are also strategies like voice recognition strategy, so you can dictate the note afterwards. So I think she's going to talk about those strategies and see how you can still meaningfully engage in face-to-face communication.
You could talk about this forever, but do you talk about email and how it can be incorporated into a practice?
That's correct. So Rajiv Chen is going to take a stab at email and also patient portals. With meaningful use too, actually it's recommended to have some form of electronic communication and e-prescribing with the patients. So he's going to talk about what is the governance and regulations, when you can and when you cannot use email.
Exactly. The privacy issues are so muddled here, it seems, when dealing with email.
That's correct. So email is actually not a secured form of communication. So the preference is to use more secure patient portals. But if patient and provider have a consent and the patients have agreed to use email, you can still, within the legal limits, you can actually use the emails.
And quickly, will you talk about social media and how that is now playing a role with patients and doctors?
Oh yes, that's a fascinating aspect. So we're very happy to have Lies from Mayo, who's a guru in social media and healthcare, talk about it. And I think there's very good ways to meaningfully engage with social media with your patients and populations, but there are some do's and don'ts. You still have to respect patient privacy and security. So I think he's going to talk about those regulations and how he's been doing it and leading the Mayo Clinic strategy. And there's something for all of us to learn from and adopt.
Absolutely. These are topics that are so hot. I got to believe that any physician practicing can benefit from some of this information. I mean, issues everyone's grappling with. Thank you so much, Dr. Atreja, for being here.
You're welcome. Pleasure is mine.
If you want more information about the activities here at DDW, please visit our blog on the web, or you can follow us on Twitter. The hashtag is DDW14.